Thank you everyone for joining us today. My name is Rachel Winters and I'm a social worker with the Public Library of Cincinnati in Hamilton County. I'm very honored to be facilitating today's discussion on domestic violence. Domestic violence, or intimate partner, gender-based violence, as it is also called, affects an average nearly 20 people per minute in the United States. During 1 year, this equates to more than 10 million people, according to the National Coalition Against Domestic Violence. Since states issued stay-at-home orders in the wake of COVID-19 outbreak, we've seen an increase in cases both locally and globally. When home isn't a safe place for everyone, it can be difficult to know where to turn for help. That's why organizations like YWCA, Women Helping Women, and the Women's Crisis Center are more important than ever. To discuss this growing domestic violence crisis, we've invited a panel of experts to join us in a conversation about domestic violence and the resources that are available to survivors. With us today are two amazing leaders in our greater Cincinnati community. I'd like to introduce Christy Birch, Executive Director of the Women's Crisis Center, and Kristen Shrimplin, President and CEO of Women Helping Women. Thank you so much for being virtually here with us today. So let's get started. Let's start with the basics. How do we define domestic violence, intimate partner, gender-based violence, and who does it affect?
Thanks for having us. Thank you for showcasing this really important, critical piece, especially during this epidemic. We know that just because this is happening doesn't mean domestic violence and sexual violence are stopping. And so when we think what is domestic violence or intimate partner violence, or sometimes you may hear it as power-based personal violence, the thing that you need to really remember, it's all about power and control. It's all about somebody having power and control over another person. Whether that's in an intimate relationship, whether that's somebody that you're dating. It happens to anybody too. Anybody, any socioeconomic background, race, religion, creed, gender identity, it happens to everybody. Kristen, what would you add to that? What did I miss?
Yeah, that's exactly right, Christy. And so I think also as we're thinking about this, gender-based violence, kind of a comprehensive term for dating violence, intimate partner violence, domestic violence, sexual assault, and stalking. And because it happens to everyone, we're really looking at a public health epidemic. Now, it may disproportionately impact certain populations, but when we're looking at public health epidemic, 1 out of 3 women may experience this in their lifetime. 1 out of 3 teens experiencing dating violence or sexual violence. When we have 1 out of 4 teen girls before the age of 18 experiencing sexual violence, that tells us this is a public health epidemic, or 2 out of 3 kids in our homes exposed to trauma. And so that's where I'm really grateful to be on here today and really speaking with all of you and being with you, Christy, in particular. As a region, how are we going to respond and how have we collectively been trying to respond to a public health epidemic, and especially now with a pandemic right on top of it. So it's a huge concern. And of course, I just have to say the disclaimer that even though our agency is called Women Helping Women, we serve all survivors. It doesn't matter one's identity at all.
That's right. That's the same for us as well. So what we want folks to hear out there is that violence happens to anybody and that we're here as well. I know one of the things that I'm hearing is that people who are committing acts of violence are actually telling the folks they're hurting that we're closed, that the police won't respond, that they can't get services during this time. And what I really want folks to hear through this is that we are here. All of our agencies, you've got a region of agencies that are working so hard to make sure that we're taking care of folks who are impacted by violence. And so I appreciate you showcasing this. It's really critical.
Thank you, Christy and Kristen. Especially that last part, I hadn't really thought about that. Okay, so what are some misconceptions people have about survivors and gender-based violence?
I think the first things that come to mind for me is that piece we always hear is, well, why don't they just leave? If it's so bad, just leave. Well, we know that that leaving is actually the most dangerous time. The rates of suicide and homicide escalate during that period of time. We know it's not as easy as simply just leaving, that oftentimes survivors we work with, their abuse happens over and over again after they've tried to leave. In fact, we know that it often gets worse, risk gets higher. So I think that's one of the biggest misconceptions, that leaving equals the violence will stop. And that is not what we experience or what we see. Other misconceptions, maybe that it targets certain populations. Or education levels. And we know that not to be true as well, that it happens to everyone. Anyone is impacted. Like Kristen said, though, we really want to say some people's capacity to access resources or have certain supports may be different. Maybe they can't access the law enforcement. They've had a terrible experience or racism with law enforcement. Like there might be reasons that there are barriers for them to escape or barriers for them to seek support or services. But we know it happens to everybody.
Yeah, I think that's right. And the only thing I would add to that is I think we're still dealing with a cultural norm that there's victim blaming,
Sure.
right? So the misconception out there is survivor did something wrong. Survivors to blame. And I think it becomes so difficult with the stigma of violence. And then to reach out and ask for help. And we see this a lot. We're a community-based agency. So we serve roughly, last year we served almost 8,700 survivors in the community. And so I think there's a lot of expectations on survivors by systems, by culture, of how you should behave, how you should act for help, how you should show up to court. Should you show up to court? Should you leave? And so I think to echo what Christy said earlier, you know, survivors are the experts of their lives. And so to do away with the perspective that some other system or person knows what's best for them is setting us all up for failure. So I think it's putting it back to survivor as the expert. And then merely our role as agency providers and others in the community we show up and we facilitate what they would like to see happen on their terms.
As the COVID-19 pandemic worsened, we saw and heard about spikes in hotline calls, and then they dropped off after the stay-at-home orders were put in place. Why do you think that is? What was it like for your agencies?
I was really frightened, actually, because I was talking to all of my state counterparts, and we'd all experienced about 2 or 3 weeks of what we felt like was silence. And that was incredibly alarming. Then when that started to shift a bit, the calls that we were receiving were picking up, but what we then experienced was that abuser was in the background, screaming and yelling, and the fight was actively going on in that moment, making it difficult then for somebody to get the information on how to get to shelter, because that perpetrator could hear that. And so that gave us another additional piece of information about how do we make sure that folks have a moment of respite that they can actually escape. Then we started to see an increase in protective orders, folks coming in and requesting protective orders. And so, and now we've also seen an additional increase in people seeking shelter. So this isolation order really has made it difficult for our survivors to be able to call us, to call any of our hotlines, to access shelter. And so we're having to find really unique ways and really rely on our community to check in with folks to allow them to have some respite to get to safety.
Yeah, and for our agency, of what we saw, specifically probably the first 2 weeks of March, when more was out there in the media, both local, statewide, and national landscape, we did see a spike in calls. It was 20% plus. But in Ohio, what happened on March 23rd was the stay-at-home order went into effect. We then saw a decrease in our hotline calls. We saw a decrease not only in the number of calls, but the amount of time that survivors were able to stay on the phone. And it's exactly what Christy just said. Now survivors are dealing with further complexities of that power and control of the abuser in the home. And they had to make choices, right? And these are the choices we never want survivors to have to make of what we were hearing on the hotline. One, can I get enough privacy to have this, to get a safety plan and talk on a hotline call? And how dangerous is it for me to call while the abuser's in my apartment home? Two, do I have enough phone minutes? And I have to make a determination. Am I going to go spend 10 minutes on a hotline call or 5 minutes on a hotline call or more and use up my phone minutes? Or do I now need to save that up? We were hearing more than ever from survivors issues with safety, needing money, needing supplies. And then we saw this decrease in them reaching out. And that's why our agency activated, I think it was last week, a text chat option. We thought it would be safer, more private, and obviously people wouldn't have to use their minutes on their phone the way they would for a call.
I believe the text chat option is also available on the National Domestic Violence Line, and we'll be providing all that information at the end. Our public library is still open to the public by way of phone calls and live chat, and since our library closed in mid-March, we have had over 8,000 phone calls and over 2,000 live chats. So we have tried to increase our staff's awareness and education regarding domestic violence in case we receive phone calls that maybe they're calling for a different reason to begin with, but then they bring up domestic violence situations in a somewhat indirect way. What are some of the nonverbal signs or verbal cues that might help identify a person in a domestic violence situation?
When I think about phone, and if you are listening to somebody talk to you about maybe some resources, do you hear that person in the background screaming and yelling? You know, what are you doing? Who are you talking to now? So they may hear those kinds of things. They may see a complete shift in tone or the way somebody's communicating when another person goes into the room. I'm trying to think of other phone kind of things that you might hear. People may ask, again, around some information for a friend. People still feel safe doing some of that. Maybe asking around resources for their kids. What else, Kristen? I'm thinking phone. I've got a lot of others that I'd love to talk about as far as what we might see and notice as bystanders in our community. But when we think about your stuff.
And I think definitely it's okay to talk about that, because I think folks that are watching this will want to be able to hear about what if they just see someone out at the grocery store who is acting in a certain way that may indicate that they are fearful of who they're living with.
Some of those other pieces, if there are people in your neighborhood that you've not seen at all, that they've not come out at all. What I'm also noticing, there are families that school officials or teachers have not heard from at all. That's another indicator. Or again, you might hear that yelling, you might see that kid on the Zoom call and then you've not seen them the rest of the time. That might indicate that something's going on. I've really been talking to people about normalizing the check-in just in general with people. Right. Like, how is it that, like people are suffering in lots of ways and experiencing trauma in lots of ways around this. And so the more that we can say, how are you doing? Do you need anything? The more doors that we open for people to say, actually, I'm feeling really depressed right now, or I'm dealing with a childhood trauma, or actually, I don't have what I need here. My kids aren't eating. There are lots of ways in which we're opening that door. And so the more that I think we can encourage people to normalize a check-in, normalize, and then have some resources. One of the things that I often find is safe as well for people is to give like the crisis text line, which deals with lots of things, 741-741, if they're giving some information to people, if people just need to chat or get some resources, or say you might know somebody who's being hurt. And so I don't know if you know about these couple organizations, Women Helping Women, the Y, Women's Crisis Center. You might need to share that. So that assumption that, hey, just having this information, you might be able to use it to pass along to another person. I think a really other important piece to remember is that we may be connected to both people who are doing harm and people who are on the receiving end of harm. And so if you're a boss or a colleague who thinks, oh gosh, that person has said the worst things about their partner, I can't imagine now that they're socially isolated what might be happening. How do you check in with that human being? How do you check in with that colleague and maybe then give their partner respite for a few moments? How do you maybe then, that's the opportunity where they can text or they can call that crisis line and figure out how to get to shelter, right? So being able to check in with that person, how do you get really creative and do a drive-by and drop off supplies for that family you haven't seen anything? Maybe you picked up the extra sidewalk chalk and you know they have 3 kids and you're just dropping it off and knocking and running and seeing if they come out and just saying, hey, neighbor. You know, there are ways in which that will help people's mental health. It will help them if they're dealing with trauma, and it may give them the respite if they're experiencing violence in their home.
Many aren't sure what resources are still safe from a public health perspective or available to them during this pandemic. What measures has your agency taken to keep survivors as well as your staff healthy?
From a public health framework, this is really difficult. And I think, one of the phrases that keep resonating with me, if you have any information and it's 4 hours old, it's old information at this point. And so I think a lot of us in the community are really trying to think through this from a risk mitigation standpoint, both for the clients we serve as well as for our employees. I can tell you that our agency on March 16th went and took our staff and we put them, many of them, on remote services. We took our support groups that typically we do about 20 support groups. We do them within jails, within mental health facilities, within the community, within our agency. That was no longer going to be feasible with the CDC guidelines, right? As I started to go from 100 to 50 to 20 to 10 people in a room. So we've had to pivot for safety for everyone involved in those ways as it relates to COVID-19. So we now operate, I think, 6 separate support groups weekly, virtually through Zoom. We immediately took our crisis and therapy, put that through teletherapy. We were able to continue with our, protection orders and paperwork and case management and crisis intervention. A lot of that we've been able to achieve virtually. And we had to, early on, the hospital systems, we partner with about 20 hospitals because we do sexual assault response. Protocols are changing. So we had to pivot and put that on in terms of us coming to the hospital, on halt. I want to be very clear, because what we've seen statewide in Ohio, at least, we're a rape crisis center as well as a domestic violence agency. Survivors absolutely still can receive emergency services. So if they're calling 911, the police will show up. They can go to the hospitals. They absolutely, if they choose that, can be seen for a sexual assault forensic exam. We've triaged with the hospitals so they know, should a survivor present both with domestic violence or sexual assault, to call us and we'll take it from there. I am happy to report that we just had a meeting where we're going to be able to get back and deploy in-person advocacy. But honestly, that means we have to interface with our county connection with Homeland Security to get our staff as well as clients thousands and thousands and thousands of masks and latex gloves. So there's a lot of policy procedures and precautions that goes behind this and activation. And so I know for many of us, think about, we serve 8,700 survivors. Many of those folks we interface with across, the year. We have 52 staff, 20 hospitals we go to. We respond to 4 police jurisdictions. We are on 2 campuses. We are in 23 schools. As we get to back as life is normal, what does that even mean? right now. I think the most honest thing I can say is we don't have everything figured out as of this moment. It's an organic process that we are aligning ourselves with others in the human service field, the health collaborative, and really listening to our partners in law enforcement and hospitals. Christy, I know your perspective with shelters has probably looked very different. You've had additional things you've had to mitigate.
Right, right. Echoing though so much of what Kristen's saying, especially around all the things we've tried to jump online to provide, whether it's telehealth, whether it's crisis counseling through telehealth, our support groups going virtual, all those types of pieces. We did switch over at some point, and just like Kristen in Ohio, we provide hospital advocacy for 13 counties in Kentucky, here in Northern Kentucky and Buffalo Trace. We respond to all the domestic violence and sexual violence folks who present at the emergency rooms. And so we ended up, oh gosh, I think it was 2 or 3 weeks ago, going virtual for that. And I'm not sure when that will switch right now, but we are talking to folks through telehealth when they do present at the hospital. So again, if you have to go to and the hospital is there as well. I know for us, St. Elizabeth really wanted to make sure that survivors knew that they could go and get the services. They could go and get an exam. They could get the support that they needed, and that they would be cared for. So please know that, and please know Women's Crisis Center is still there as well. As far as shelter, we operate 2 24/7 shelters around intimate partner violence for men, women, and children. And we've done many, many things to make sure that staff and the wonderful people who stay with us stay well and healthy. That includes everything from, we went really early on March 16th to 3 different groups of staff. So we would limit exposure to people, and that when those staff weren't at work, they were self-isolating and staying home to make sure that those staff would stay well. And then when the staff were in-house, there was a ton of procedure. We're not wearing shoes that are from the outside inside. There are a lot of different things. We have an intense cleaning protocol that's happening twice a shift, and we have 3 shifts during our shelter workday. We're doing those kinds of things. We've done some separation. As you can imagine, when we're trying, like Kristen says, when we're trying to take care of thousands and thousands of the most vulnerable people, we provided 17,000 bed nights last year in 2019. And so, as you can imagine, if we lessen our capacity, people could be isolated and not safe. And so what we've been able to do to keep people healthy and well is we are now alternatively quarantining healthy at home folks who want to access our program now for about 14 days. And then we'll cycle them into shelter if they're well. As well as we're sheltering folks in an alternative location if they're out working on the front lines. We have some incredible folks who are working on the front lines on a daily basis, and we're making sure that they're safe as they're working, and also keeping folks staying with them safe and healthy and well. Also, our court proceedings are a little bit different in different places. Some folks are still in person. And when they're in person, we are there with you. And when they're not, we're doing things through Zoom and all kinds of other ways in which we can connect with people technologically. So we did close several outreach offices, the Hebron office, the Covington office, the Maysville outreach office to the public. However, all of those services around appointments, crisis management, they've just moved to a virtual experience. But we are doing everything we can, just like Kristen, just like the Y, to make sure that folks have access to us. And our shelters are open. Our 2 24-hour crisis hotlines are open as well. Those aren't shutting down anytime. Neither are our shelters. We're here, and we're working with all of our local officials. Our state coalitions as well have been incredible. We, like Kristen, we do need, I think sometimes folks do forget we need that kind of protective gear also. I think the other thing that we could use from our community are alternative places as folks become ill. Where can folks go and shelter safely and be safe, and yet not make the rest of our population ill as well, or our staff. So we're working really, really hard with folks, and the outpouring has been incredible, and we so appreciate that.
It sounds like both of your agencies have amazing, passionate, self-sacrificing staff.
Oh, they're incredible.
That's what I'm hearing, because that what you talked about with staff coming in and not even wearing their normal shoes, cleaning as much as they do, that tells me that they're really there for your mission. And you answered so many things about the next question that we had, which was, what else do your agencies do? And I think a lot of times people think, when they think of domestic violence agencies, they think of a crisis line, a shelter, and counselors, but they don't realize all those things that you both mentioned in the court systems and in jails, on campuses, in the hospitals. I mean, they just don't realize the amazing work and where you are, because domestic violence is everywhere. So I greatly appreciate you expounding on all those things. Can you share a little bit with us how COVID-19 has affected your agency's funding? I think we forget that agencies really do rely upon a lot of face-to-face interactions for fundraising, and what that means for your agency and how you will survive this time period.
Yeah, absolutely. So I think that's where it's scary, right? And I think it's scary for everyone, no matter what path you're walking through. I think our country absolutely is engaging in a recession, and we have to look forward, really into the future. Is the recession going to turn into a depression due to this pandemic? And I think we're just starting to see some indicators. Right. So financially for us, the indicators we were looking at of what we saw in March now look completely different in April. So initially we thought, okay, we're going to project about a $200,000 loss of expected revenue due to the impact of COVID. Concrete wise, what does that mean? We knew we had to cancel a gala, for example. And we are only a $2.6 million agency. So those were some of our projections, and some other pieces we knew just weren't going to come in with revenue. So we did that projection in March. We did that projection again last week. Now that is up to about $390,000 that we feel we could really see the impact, because initially it was things like donations or galas or special events that were just like sidelined. We have a specific initiative with bars. Well, that's not really going to work out too well right now, right? So that got sidelined. We have a social enterprise that gets sidelined. And then last week for us in Cincinnati, we are an agency that's part of what is called the Human Services Funding. So now we're starting to see indicators of existing contracts, not future applications, existing contracts, where they cut it 25%. So that's already in our budget. That is tied directly to the work we do. That's gone. No discussion. And so we feel that is the next, some of the next wave of what we're going to be seeing, not only with future government funding and applications, where things just have to really be cut, but we are preparing ourselves for our existing contracts that are really diversified. When partners surface and say, I'm sorry, this can no longer be. So for us, what does projected possible $390,000 reduction in revenue look like this year at our agency? That's about 15% of our total budget. But I will say, we're very grateful to the philanthropic community who has been coming forward to help us kind of really narrow that gap.
Yeah, I certainly can echo that with Kristen. Where I'm sitting, I mean, we're definitely going to be losing revenue, losing resources. I think it puts a level of uncertainty around what grants will be available for us to apply for. Will some of those federal funds that sustain us, will they be shifted? And then I think where we are as an agency, we did a big strategic plan literally 3 weeks before COVID hit. And so we've been full in both of our shelters since July of 2018. And so one of the things we were talking about in our strategic plan was creating at least 10 more beds in each location right now, and also looking at a new shelter. And so when you think about the need that our community has, and that we serve 13 counties, and like Kristen said, we have minimal, like it's like 3.2 million, which is awesome. But for 13 counties and 2 shelters and 2 rape crisis centers, when we look at that, it's going to be critical, and we are relying on the generosity of our communities, and they are incredible. This is a beautiful region, and we're going to need to ask for additional support around this, because what I know when this is over, and what my colleagues know, is that our need for services will be even greater. That I'm looking more that long term after this, and the implications of trauma. And so when we know, and the National Sexual Assault Hotline has received more calls from children than it ever has in its entire history. And we've got to figure out how to provide support, not only to make sure and try to be active bystanders right now to lessen this trauma, but we're going to have to make sure that we support the already existing agencies to wrap around this trauma, to figure out how it doesn't manifest in communities in other ways. When we look at drug addiction, when we look at all of the things that trauma really is creating in our society, we've got to really make sure. I feel like as an agency, we are gearing up again to be able to look at numbers we've never seen before in the 23 years that I've done this work. I don't think I will ever experience anything quite like this at the end of this. And so we've got to, as an agency, prepare to serve more and more people with potentially more limited resources than we ever have before. And so like Kristen said, like most of the way we're going to be asking for money is going to look very different. The things that we've relied on in the past, I'm afraid, may not be there. And we also simultaneously have to grow. So it's going to be very, very critical. I mean, some basic things, as you can imagine, our food expenses have shot out the roof because folks are really quarantining with us and eating 3 meals a day instead of our kids going to school. We're hoteling folks for their own safety, and so my gosh, that's costing us thousands of dollars a week that we didn't anticipate. So the technology, those are often things staff don't maybe have what they need to work remotely. We have old computers that we refurbish and, try to raise up from our bootstraps. They don't work very well at home. So all of those kinds of things are things that we're not anticipating, but we must do, because we've got to take care of these folks in need, and we've got to still be there for people. So
I think we all know in the community of human service providers, nonprofits, folks in the community, for-profits, the one thing that we've really tried to do in this region collectively, and I feel that we do this, right? Whether it's in Kentucky or in Cincinnati, we are absolutely able to collaborate and play well with others, right? And I think we've seen that before a crisis hit. And now I feel like it's bringing out the best of us in many ways, for those of us who do like to collaborate and play well with others. And I really hope that that's an additional outcome, like a hopeful outcome that emerges from this. We're seeing that from the funding community, right? How a lot of them have come together. Mm-hmm. And, and you see this, right, with Women's Crisis Center, Women Helping Women, and the others. We support each other. We have to. And we also have to extend and support to other sectors. Those who are in behavioral health, mental health, housing, work job placement, all of that, of how can I show up for, your mission? How can you show up for us, and how do we collectively do something that more, more than a hashtag of in this together. What does that mean? And I think that's just really critical for us to think about through the nonprofit sector and human services sector, because it's always been nonprofit. Back to the whole reason, generations ago, centuries ago, literally, where our sector started. When the government cannot meet the need, where private sector cannot meet the need, that is the birth of the nonprofit sector, and specifically social services.
So our time is ending, and do you have any final messages you'd like to convey to everyone out there in the world watching you?
I think for us, I know that we want to make sure that folks know that we're here. Call us, reach out to us. We're not closed. Reach out to a sister program. If you need something, if you have a question, if you're calling on behalf of a friend, make that call. We're here.
And I would say the same thing at Women Helping Women. Call, text, chat, it's all the same number. We're here 24/7. And I know from our lens, it's the same as Christy's lens at the Women's Crisis Center. Survivors, you matter. We believe you, and we're here for you.
Again, thank you for your time to help educate and bring about more awareness to this important topic.
Thank you.
Thank you.
Thanks so much.